If you've been struggling with lower back pain and you land on this page, you might be wondering, how the heck is an upper neck issue going to help my lower back? Well, let me walk you through how this happens. A lot of our patients that come to us with lower back issues have already had all the usual things done to them. They've had MRIs, CT scans, different types of x-rays, massage, general chiropractic care. They've tried different mattresses, different pillows, physical therapy. Nothing seems to be working. And all of that was directed at their lower back, thinking that's where the problem was rooted. And obviously something's been missed because it keeps coming back. So where we get different results is because of where we look. And we look at the upper neck, believe it or not. And here's why. Your lower back's job in terms of its alignment is trying to keep your head and neck level. That's its primary focus, right? Your lower back is literally in the middle of your body. And there's a reflex not everyone knows about called the riding reflex. And the riding reflex refers to like riding the levelness of your head. Almost like a sailboat will find its normal riding position in the water. So the levelness of your eyes and your ears, or the levelness of your head, dictates how well the lower back is going to be lined up. And the levelness of your head is based upon what's happening in the upper neck. So an upper neck problem, like a little kink with the structure of the upper neck at atlas and axis, or C1 and C2, can cause a little bit of a head tilt. The body doesn't want the head to be tilted, so the body will use everything else beneath the head to bring the head level again. And that's how you get this consistent or chronic compensation pattern in the hips and lower back and mid back that begin to hurt and ache. If it's there long enough, it'll cause some arthritic changes that you can see on x-rays. But nothing that you could do in the lower back area is going to fix it, because it's happening because it's trying to compensate for the upper neck area. So in many of our cases have had lower back adjustments. They feel like, oh, I feel better for a few hours or a few days, but it always just seems to come right back. Exactly. Nothing actually addressed the root cause of the problem, which is just this neck-lower back relationship. So what we do that's different is we take a very close look at the structure and alignment of the upper neck as it relates to the alignment of the whole body because of this neurological reflex. So the first thing that we do when someone comes in with chronic lower back pain is we actually do a functional neurological test using, it's called infrared thermography. It's very safe, it's very effective, it's non-invasive, it doesn't make anything worse, it just reads information coming off of your skin. And this functional nervous system test can tell us if in fact there's a problem with that upper neck neurological or nervous system relationship. If there's what's called a thermographic pattern, that's going to lead us to the next step in the process, which is doing a very careful examination of the upper neck area, both with range of motion testing, some palpation, so manual, we feel it. We also do a series of x-rays called biomechanical x-rays. Now again, we haven't even got to the lower back yet, which is where the main problem is coming from, but we're still focused on the upper neck, and people are thinking like, why? I told you the problem's in the lower back, why don't you look at my lower back? Well, 9 out of 10 cases that have come to see us have already had lots of people look at the lower back and they haven't found anything. And B, we know there's a relationship between the neck and the lower back, and almost no one's looked at that relationship, so that's where we're going to start. So we find the problem with thermography first, we do the hands-on exam, and then we take biomechanical x-rays, which means we have x-rays of the head and neck in different positions so we can see if there's a stuck joint between the atlas and axis, or C1 and C2, the top two bones in your neck just beneath your skull. If there's a problem there, that's where we know we need to make the adjustment. Sometimes we will take an additional x-ray of the lower back if it's been a while. In many of those cases, we do in fact see a lower back that's not lined up properly. Sometimes there's arthritic changes or arthritis happening in the bones. But we can confidently tell the patient, and I can tell you in this video, that your body, your spine can't be pushed and shoved back into place. It's muscles that hold the spine's shape. Bones just sit there and wait to be pulled on by a muscle. So you can push and shove bones around, but if you don't change the tension of the muscles around the spine, whatever alignment problem you are trying to fix is just going to come right back. And so the key to getting lasting changes with how the spine's lined up, and in this case with lower back problems, is to make sure the neurological signal going to those muscles around the spine is normal and neutral, allowing both sides of the spine to have equal muscle tension. And so by addressing the upper neck problem and addressing this riding reflex that causes lower back alignment issues, that's how we get lasting changes with somebody that has lower back issues. Now, we also take a look sometimes at inflammation. The subjective level of pain someone experiences can sometimes be made worse with inflammation. So If somebody comes into us with a 7, 8, or 9 out of 10 pain level, we're not only looking at the nervous system upper neck relationship, but we're also looking at blood chemistry problems and seeing if we can help them lower inflammation by making some good choices with their diet and their lifestyle, getting better sleep. Those are also going to help somebody feel more comfortable. And there's also a bit of a self-care routine. We make adjustments very carefully at the upper neck, not on every visit because it's not needed on every visit, but we also understand that the person has been experiencing and living with these chronic muscle tension patterns for, in many cases, years, if not a decade or more. And so making the precise adjustment in the upper neck is a great starting point, but in some cases they're going to get their relief they're looking for faster by also doing some very specific exercises at home, not your usual stretches that you might get from physical therapy or massage therapy. We're not asking you to stretch the tight muscles. That doesn't often have a very lasting effect. But we're focusing on helping you learn how to strengthen the weak muscles, the ones that have been neglected for years. That's what's going to help pull the alignment of the spine back to normal again after we've addressed the reason it's coming, the reason it's been happening in some of these cases, which is an upper neck problem. So if you have any other questions, you're always welcome to read more information on our website, sourcepointcare.com. If you're seeing this video on YouTube, you're welcome to leave a comment in the dialog box, and I'll get back to you as soon as I can. But don't ignore the significance of an upper neck problem as it relates to a lower back problem, especially if you've done everything you can think of for a lower back issue and it's still with you.